adding people as they come in. But this presentation is about working with women in postpartum. Some of them has depression, anxiety, or some of them just having a difficulty getting on with all the thing that has to go on and changes on that kind of thing in solution focused brief therapy. I have been I have been working with women since 2014, especially for the purpose of working women in postpartum. Before that, I was just talking with Naomi, but I started as a child family therapist at the community agency when I just graduated from graduate school in the counseling. And so that's, yeah, so this is a presentation on that. So I'm going to start sharing my PowerPoint, if that's okay. Thank you, Aisha. So working with women in postpartum, I said on the syllabus or Padlet, it says postpartum depression, but I dropped the depression part because it's not only the depression symptoms that we are working on, it's working with women and their families. And I wanted to capture that. And so I changed the title a little bit, but I hope this presentation will be helpful. So as I said, I am a marriage and family therapist, has been working with families since 2006. About 14 years. And I have been fascinated with working with families since I was, in a graduate school, always wanted to work with family. I think it has a lot of, because of the how I grew up. I grew up in Japan, where family unit was very emphasized and very important unit of the society, or how you grow up and how you are relating to others and all that kind of thing. So that family, working with family is always my fascination. I came across the solution focused brief therapy through interviewing for solutions. I was just sent to a conference by my work to go to a conference for 4 days, free of charge for me. And I was like, okay, if it's free, I will go. And I didn't know anything about the conference itself. And it was happened to be solution focused brief therapy. Joel Simon from New York, United States was doing the presentation solution focused brief therapy 101 as a pre-conference workshop. And then he was introducing all the tools, mindset about solution focused. And I was like, this must be it, because I'm so interested and I was so excited during that conference hearing, respect to the clients. And then I don't have to know everything about the problem. I don't have to know everything about the clients to help them get better. As I said, I came from Japan to United States, whereas culture are different, the language is different, so many differences that it will take ages for me to understand entire culture, entire language to be helpful. And I was like, I have to find something that works for me to be helpful for clients. And this is how I stumbled to the solution focused brief therapy. And when I was reading, interviewing for solution, the first chapter, I wants to introduce books because I love books, and that's why I have a solution focused book club too. It just it fascinates me about reading books and getting information. So in chapter 2, there is the transcript of the interview with Rosie, and her concern was how she get on with so many kids and so little resources, and she's stressed as a mom. And as I was reading, it is about the family. It's not about just helping this individuals who is having a difficulty. It's helping entire family. Relationship questions stood up for me and all that kind of things. So that's how I get on and start using in the work when I was doing a work with children and family at the community agency. So later on, that I learned more about it. And then I stumbled this book of Move to Tears, Move to Action. This is by Jane Latham she was used to be at the Brief back in a time. This is a book published in 1994, so it's been about 30 years since it's published. And this is written from a woman perspective, that she is realizing a lot of theory and therapy was written from a male perspective, and she wanted to point out some differences that she might have as a female therapist and working with families, women, moms, definitely, and how is it working in solution focused brief therapy. And this was very important for me to read when I start working more with parents. A lot of time, mom brings the children to the therapy session, and they know a lot about their child. And so I was like, I need to know a little bit more about how, me being a female therapist may be different from what is written from male therapist perspective. And one thing that stood out for me, and I still kind of use, is the part that they were working with a mom from a refugee from Africa, and they are struggling a lot. And the first appointment, the therapist asked about a lot of coping questions about how did you cope, what did you get through each such a terrible ordeal, what made you determined to keep going. And so she really went on, instead of try to build preferred future, or getting on more detail about rich description about preferred future, she went on with a lot of coping strategies, which I felt a little bit kind of new, since when I was learning solution focused brief therapy in the beginning, the structure of how it's supposed to go was like, oh, you have to have preferred future in details before you can go to coping and exception question, a very kind of rigid structure that I was learning. So it was really nice to know, like, okay, even if we focus on only one section of solution focused brief therapy, it is still very powerful. And then this end of the second session, it says over here that the mom said to the therapist that you were the first person who ever said anything good about me as a mother. And it's really struck me as a mother, being critical and, oh, I'm not good enough sometimes. And it is really important for me to say, like, yes, this is what the client really needs from therapy. So after I learned about solution focused brief therapy, and then I had my children, and for the second when I had the second child, I had a severe maternal postpartum depression, where I was in a very dark place for a few months, where my husband was really concerned. And he was like, you're not doing anything unless you see a therapist or make an appointment right now. So with his help and the therapist helps, I got some help, but some of the things that I was feeling like it's missing from what I needed from therapy. And then I remember therapy show from Denver, Colorado, said like, when you want to get better at solution focused brief therapy, not only using in a therapy session, but use it on yourself. You're always with yourself 24/7. So you can practice it on your own and ask these questions for yourself when you are reflecting on the difficulty you have. So that's what I did. And it will help really, really a lot in terms of how I can credit myself for doing or living every day or attending to mundane things that we have to do as a mother. So I want to go over things that, these things, changes that women go through when they have a child that can affect mental health of that mother. And then even though we are talking about maternal mental health, the depressions or anxiety or difficulty adjusting can happen to father or non-biological parents, such as foster parents or um, adoptive parents, or grandparents who happen to be a main caregiver for the newborn. So it's not only a mother, but it can be any caregiver who care for infants. So physical changes, especially if you're a birthing mother, you go through 9 months of tremendous hormonal change, physical change, the backache and all that kind of thing, weight gains, vision change, hair falling off, all that kind of things. And even 1 year after the delivery, you have adjustment period or recovery period that you go through. And it's not just like, oh, you delivered, okay, physically you're fine. There is a long period of recovery. Emotionally, the pressure of caring for infant who looks so fragile and emotional difficulty, of course, the physical changes or hormonal changes affect that as well. And identity changes, you adding on another identity of being a mother, which can take completely, or some people decide to go back to work and they have to kind of figure out, how do I hold these new identity when I want to keep some other identity? And then I think that it's very important that mother keeps other identity as well, instead of just becoming a mother. Relational changes now, instead of having two people, if you're having a firstborn child, instead of two people in a couple, there is three people in a family. So the relationship became much more multi-layered. Instead of just two-way going on, it's gonna be 9 ways going on, right? And then also relationship changes in terms of in-laws. Now you are seen as a mother instead of wife or mother, daughter-in-law, or, oh, she is, my daughter, she is now a mother. So the position changes as well. And then that comes with external expectations, all that kind of things. And then financial, of course, in United States, at least, it's costs a lot of money to give a birth at home, at the hospital. Even at home, some people choose to give a birth at home. However, it's still a lot of financial cost to the parents. So, and then of course, with the career changes that you might, the one person chose to do or forced to do, there kind of have a financial consequences that come with that. Social, because of the career change of identity of being a mother, the social status of the person change. There is a more talk about capitalism of motherhood. There is a TED talk about the capitalism of motherhood, that we are not paid to take care of the child. We are not paid to chauffeur the kids around. We are not paid to, be a nurse at home. However, we are doing these tasks for free in a way, but we lose the status in society in capitalism where we are not earning as much, or we are not working as much, and that affects the mental health of the mother, especially when you are established professional and going to a stay-home mom, and you lose all the social interactions, professional connections. A lot of times you will lose income which supports the family, and you lose kind of a status in a society where you are professional, that come with the identity of independent, that kind of thing that society values. And then of course, another point about social is the social expectations of what does it mean to be a mother. In where I live in Denver, Colorado, and it's very highlight is like a physical fitness, going outside. We have a Rocky Mountain, so it's beautiful to go outside and then take a stroll. However, so there is a lot of pressure of like, oh, let's go out and walk and talk with your baby, right? But if somebody is not fan of these kind of activity, it can affect the mental health of that mother, of what kind of mom am I? I don't fit into these ideals. So that can be influence of our influence in the mental health of the mother. And the next chart I want to show is, so some women go through the postpartum, meaning the 1 year after the baby is born, with some difficulty in adjustment, some time that you feel blue, but you are able to cope. However, some women has depression, anxiety that clinically diagnosed. Of course, in solution-focused brief therapy, it's not that big emphasis on diagnosis, but I wanted to show this chart of how these postpartum depression and anxiety can be relevant. So this is data from United States, and I know we are all over the world, so I'm not really sure how the number look like in your country or in your region. So I wanted to just clarify that this is a number from United States. So gestational hypertension is 6 to 10% of the women during the pregnancy that suffers. Preeclampsia is about 7%. Gestational diabetes that we all get notified by nurses, and then they check on that at least for my doctor, they checked on it every single time I went to see doctor. They checked about if I'm a diabetic, that kind of things. And then that happens to 5% of women who carry the pregnancy. However, and then I want to mention that perinatal mood and then mood disorder and anxiety disorder is about 20% of women who went through the pregnancy. So as you can see here, it's a lot more common. However, it's less emphasized in a medical community or in a social community. Yes. All right. So I was learning as I was getting better. I would start to learn about postpartum, how things are working. I didn't know much about the biology behind it. I thought as I get the birth to the child, you know, the body do what the body needs to do, and there's not much I can do. However, going through the postpartum depression, I got curious about what's going on that I didn't learn as I was taking a childbirth class or getting ready to bring the child to home, kind of classes that I was supposed to take before the delivery date. And I get to learn more from I came across this organization called Postpartum Support International. uh, they started in United States, but now they have some chapters in Germany, some chapter in Canada, some chapter in Mexico. I'm not really familiar with chapter elsewhere. However, they started branching out more internationally and have more chapter in many regions of the world. So in their workshop handouts, the purpose of psychotherapy support that we are to provide for women is about increasing opportunity for change, increasing hope, changing perception of self. As I was learning about these psychology help for moms, psychological help for women in postpartum, I was kind of surprised that I didn't see the word solution focused brief therapy, because as I was learning previous to having a child, I thought, oh, this will be, you know, perfect for working with mom. I see a lot of examples and interviewing for solution, the video that solution focused brief therapy association have. So I was like, why it's not, you know, recommend, it was not a list of evidence-based practice for working with women in postpartum. It was psychodynamic, CBT, and family therapy were the still recommended practice at the time. So I was like kind of puzzled. However, when I was looking back, I I was studying more, I was like, no, it should work, because these are the things that we do in solution focused brief therapy, increasing opportunity for change by asking preferred future questions and amplifying what the change they already happened that they made, increase the hope by pointing out what they have already noticed that they're doing well, going through their resources and strengths that they have, knowing a person as a whole person instead of just as a mother or just as somebody who is going struggling in postpartum, being curious about themselves, about the clients, and you know, thinking about what's a possibility opportunity that they have in the future, and then change perception of self. We do that through different techniques in solution focused brief therapy, about asking like, what do you learn about yourself since you made this change, right? So I thought these are, you know, that we do in solution focused brief therapy already. All right. So I'm checking my time and making sure that I will end on time. Okay. And then common clients goal that they initially tells me is I want to deal with changes or other stressor effectively, communicate effectively with others, such as doctors, my husband, uh, and my in-laws, increase self-esteem. I want to feel like myself again, or I want to feel like who I am, and improve social psychosocial functioning, right? So one of the tenet about solution-focused brief therapy is collaboration and co-constructions. And I want to share a story about my client. I will say her name as Amy to, which is not her real name, but to, respect her privacy, I will call her Amy. So she came in to my practice because of the anxiety she was feeling outside of her work. She already went back to work at the 6 weeks postpartum, and she um, was like, I cannot go to sleep. I have a terrible feeling when I come home. So I really need to talk to somebody. And then so she came. She used her employee benefits called EAP in United States, employer EAP assistant program, where they pay for the employees to obtain the therapy services or doctor services, that kind of things. And then so her insurance allow us to see only 6 times. And she was like, I'm not sure 6 times would be enough because this anxiety is so debilitating right now. I read she was very professional, very career driven woman, and she has been in this company for about 15 years. She was close to top management position, and she was like, I know this department in and out. I have been working in this field very long, very confident, very self-motivating woman. And she said, I researched about therapy, about postpartum anxiety, and then it said it may take 6 months to a year to feel better with the medication help. So she was like, I'm not sure if this 6 months, 6 time will be enough for me. However, of course, we start working with a question of, so what would you like to be different after 6 times of meeting if this was useful for you? And she said, I know, I don't want anxiety, of course. And if the anxiety was gone, how was it look like? And she pointed out, it's not about the delivery and pregnancy that I'm worried about, that I went through. It was a little bit hard pregnancy. It was difficult delivery, but it's not the issue. Issue is about relationship with my in-laws and how we decide about parenting strategies. So we corroborated in that goal. Her doctors who recommended to see me, and then her husband was saying that, oh, you need to process what happened during the delivery, because that was not what you wanted, and you should that should be the issue why you are having anxiety. But in the solution focused brief therapy, we don't really have any idea of what they want in a session at first. We come in with, idea that clients have something that they want to be solved or be different, instead of us having idea, not knowing stance, and putting the clients in expert. And that's what I did. And she was able to feel like, okay, I can do this and really focus on what I need to do in six meeting. And at the end of the 6 meetings, she was like, no, end of the 5th meeting, she said, I know we have another meeting that we can use, but I don't think I need to use it because I think I can handle it and I have some idea of what I need to be doing next. So we didn't use her 6 sessions and she was off on her own. And yeah, so that's the story about the collaboration. And then the next one is acknowledging and coping question and exception question. So yeah, the mom says that you're the first person who ever said anything good about me as a mother. So I want to show you next comic here. The cup says, "This is the best coffee ever." And the coffee maker says, "So aren't you going to give a credit where credit is due?" And then the coffee mugs say thank you to the coffee beans. That happens a lot to the mom. I noticed that they were overlooked. Another story that I personally encountered is a conversation with my daughter's friend's father. We have a same way to go to the school by walk. And in one morning, he said, "Oh, what's your plan for the weekend?" And I said, "Oh, I have a conference to go to, a solution focused brief therapy conference." And that time it was in Canada, Montreal. So I said, "I will be off about 5 days. So I will see you next week." And the next question he asked is, "So who is watching your child?" And I was like, this person, this man is well educated. He is a very successful business person, has a wife, have a very wonderful family. However, still, who is going to take care of your child when you're gone? Instead, I'm sure he would not ask the same questions if that was my husband saying that, "Oh, I'm have a business travel for five days." There is assumption like, okay, he will be, wife should be taking care of that. So there is a little disconnect. So a lot of time, instead of opening the session with a lot of preferred future question, I a lot of times start the session with coping questions or exception questions, where they try to identify a few things that they have done in terms of keeping themselves safe or keeping themselves going, even though there was a lot of difficulties up against them also. And that happens also in the working with Asian women as well, where I asked them, "How did you happen to do this kind of hard thing that you said you did?" And they credit to other person, "No, no, no, this is not my doing. It was my husband's help," or, "I was just at the right place at right time." And then it is very, I think, important to ask more about how do you take advantage of these advice. You are the one who made a phone call, or you are the one who made yourself to go for a walk outside in the evening instead of somebody dragging you out of the house. How did you do that? And then going back to kind of give a credit to a mom who is making differences. All right. And then also we use a lot of scaling questions in the session, setting own goal instead of what I'm supposed to be as a mother, or what I'm supposed to be as going back to work. And then one of the story that I want to tell is that the client that I worked with using only 6 session limit. And then her goal was about getting, making decision that fits for her about how you're going to raise the child. And one of the things that she mentioned is that I don't want to be just letting my in-law decide. I want to make sure that I have a say, and I'm making a decision for my child. But I don't want, at the same time, I don't want to be this very stern, I don't need any of your help kind of mom either. So like you can see over here in this picture, it has a gauge, and then one way was her completely listening to her in-laws, and another gauge was to be completely stubborn and completely block off the in-law from her life. And then she have to find somewhere in the middle where she was comfortable, over here in that middle yellow range that it has over here. Oh, see. So you in a traditional solution focused scaling, 1 and 10 is about what they wants to achieve, and 0 is completely opposite. However, solution focused brief therapy allows a lot of flexibility in using solution focused scale, so that the client can develop their own goal, own scale, and then kind of think about, okay, if I'm going to this way, I need to do these kind of things to keep myself kind of centered. And then these are the things that I want to notice, being in the center where I feel comfortable being. So these are the words that works that I have been using. So and then I was longing to see some of the scientific backup to say, like, yes, of course, solution focused brief therapy works as well as other modality working with women in postpartum. And finally, in 2016 and 2021, there are articles on scientific research working with postpartum women or postpartum depression. And so I was very, very happy to see that, because I'm not researcher. I don't have a facility to conduct a formal research like this. So I was very, very pleased to see that in both research saying that, solution focused counseling is as effective as cognitive behavioral therapy that they conducted with women going through suffering from postpartum depressions, the same thing that was found in 2021. The newly parous pregnant women, meaning that they had the normal pregnancy that they went through, instead of difficult pregnancy or full-term pregnancy, I think. Yeah. All right. Thank you for asking that question. Yeah. Yeah. Right. So, yeah. And then, like I mentioned earlier, there is reminding competences is very important through the coping questions, through their work that they have done already. So we can, if you would like to do this activity, you may. I got the inspiration from John Wheeler and his activities called Certificate of Competence. I plugged in parent point of view, since I work a lot with the parents. And so if you like to take a sheet of paper, we can take about 5 minutes to answer these questions for yourself. And we can have a little discussion of how it was, the influence of that answering these questions was for you. So I will just be quiet for about 5 minutes now. So it's been a few minutes. Of course, if you didn't finish answering all these questions, I think it will be on YouTube. And then also, if you would like me to send these PowerPoints, please drop your email address in the chat in direct message instead of going to everybody if you would like to keep it private. And then I'm happy to send this presentation to you if you are interested. So please send me your email address if you're interested. So with the few minutes you had in answering these questions, I would like to hear a little bit about how it was for you answering these questions.
Hi.
Hi.
Yeah, it was really yeah, I loved the one about asking what your children appreciate about you, and even though like I'm really tired today, I still, once I started listing it, something really beautiful happened. I was thinking, I don't know, it really shifted my lens of what she might notice, and I thought, yeah, actually I dance with her and I read books and and the more I thought, and it was just tiny things, but the more I thought, the more significant I thought, probably there's enough that offsets those times I'm grumpy or, yeah.
Yeah, yeah,
Lovely.
lovely. Thank you, Naomi, for sharing. And Santos, agree with you too on the chat. Yeah. Who else like to share your experience of answering these questions?
I think the questions, I'm a grandmother, but the questions and a counselor, but they really, for me, apply to the moms I work with whose children have special needs, especially one who has twins. And it seems like the postpartum almost never ends because there's some issues with developmental delays with children where you're in a very intense caregiving role over a very extended period of time. So that I was like, wow, some of these kids are 6 and 7 years old, but these all still apply. There's not been that usual expected kind of independence that grows. I mean, it's growing, but at such a slower rate.
Yes.
The mom's still struggling with a lot of these issues. So yeah, very powerful. Thank you very much for sharing that.
Yeah, and then I think you said beautifully, it's never ends, right? Once you're a mother, you never be a mother, even when your child is grown, or in unfortunate event, if you lose your child during the pregnancy or after delivery, or you know lose your child for any reasons, you still mother even if you don't have a child. And that is one of the things that is so important, that we acknowledge that, oh, we lost a child during the pregnancy early on, maybe because it's 1 in 4 pregnancy ends during the pregnancy because of the biological issues, nothing to do with how your mother was or how the father was or anything to do with it. But that happens. But still, for that short period of weeks that you became mother, carrying and thinking and taking care of yourself. So yeah, thank you for pointing that out, Carol. Yeah. And you know, and I love the first question, is that because, you can take inspiration from anywhere. It opens up. It doesn't have to be your parents only or who you grew up with. It can be anywhere, your teachers, your movies that you watched, or, day-to-day conversation with somebody else or your colleagues. I get a lot of inspiration from listening to, many of your colleagues here, Aisha, for sure. Yeah. Right. So there can be very much so. Yeah. Yeah. Lovely. Okay. Oh, so it's top of the hour, so I need to close this presentation so you are able to take a break and go to the next presentation. But I will be stay here a few more minutes to ask any question, answer any question you might have. These are contact information that you can contact me through. So thank you so much for attending this workshop, and then hopefully you will have a good rest of the SF24 and be more inspired and excited about solution focused.